Hot flashes, mood swings, achy joints. Menopause can be a lot. For some women, hormone therapy can take the edge off by easing those symptoms. It used to be called hormone replacement therapy, but doctors say for most women, it's really just about getting relief during a natural life transition. Reporter Viv Williams explains in today's Medical Mythbuster.
Hormone replacement therapy, or HRT, for treatment of menopause symptoms is a term that's been around for a long time, but healthcare providers don't call it that anymore.
We call it hormone therapy, and the reason for that is we are not trying to replace what the ovary used to make. We're only trying to give enough estrogen to manage symptoms.
Dr. Stephanie Fabian is the director of the Center for Women's Health at Mayo Clinic in Jacksonville, Florida. And she's the medical director of the North American Menopause Society, an organization dedicated to promoting women's health in midlife and beyond.
This concept of replacement really only applies to those women who go through menopause prematurely, under the age of 40, or early, between 40 and 45, where we really are trying to replace what they lost.
You see, Fabian says menopause is natural. Women are supposed to go through it. It is not a disease to be cured.
When we talk about hormone therapy at the normal age of menopause, so say for a woman in her 50s, we are not using hormone therapy to prevent any chronic disease. We are using it for symptom management.
But if a woman goes through menopause too early, the loss of estrogen is not considered normal. Fabian says in that case, replacing lost estrogen is important.
Because it's really a hormone deficiency syndrome there, and we are trying to prevent long-term adverse health consequences related to it, like heart effects, bone effects, and brain effects.
The U.S. Health and Human Services Office on Women's Health notes that about 5% of women go through early menopause, the causes of which vary and can include your genetics, some cancer treatments, and some autoimmune diseases. Most women don't experience early menopause, but the National Institutes of Health says of that group, 85% have some degree of menopause-related symptoms.
While these can be very mild symptoms or even not a problem for some women, these symptoms can be quite debilitating for some women and really impact their ability to function during the day, to carry on their relationships, to function at work.
Fabian says for women who struggle with menopause symptoms, hormone therapy can be up to 95% effective at managing them. She says forms of treatment include patches, sprays, gels, rings, and pills. With this Medical Mythbuster, I'm Viv Williams.
I love how she said menopause is natural and we can recognize that, and so you shouldn't do anything. Childbirth is natural, but you should and you can do something to have an epidural if you need it. So just because something's naturally occurring doesn't mean you don't do the steps to help circumvent the problems that are created by it, be it the pain in childbirth or the diseases that come after menopause.
So there's a difference, number one, between estrogen and estradiol. 17-beta estradiol is different from estrogen. And a lot of people don't understand that. So many times everything is lumped all together. But 17-beta estradiol, it's hydrating. It's the reason why you walk into a room and you know why you came in there. Yep. It's the reason why your eyes are lubricated, your joints stop hurting. There's a reason. And it acts as a natural antidepressant as well. And it helps with memory.
Yeah. I think what I'm getting out of this is if a doctor says something, keep pursuing more and more information to get a deeper, more complex approach with both functional and traditional medicine to get what works for you.
Right.